It's time again for Health Monitor, the number one program that's shows you how to live a life in its healthiest way. To improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the number one health show, yeah.
Welcome to your favorite health program, Health Monitor, your guide to good health. I am Ajenike Famujuro Fakayode. On the program today, we have the health tips segment, assisted conception and body care. Stay tuned, we'll be right back.
It's Health Monitor, the number one health show.
How to deal with constipation. Constipation can be treated at home. First, try gentle exercise. Take a short walk each day. Make sure you drink enough fluid. Most adults should try to drink between 8 and 10 glasses of water or non-caffeinated beverage each day. Include fruits, vegetables, and fibers in your diet. Schedule time each day for a bowel movement. If you are still constipated, add some processed or synthetic fiber such as Citrusel or Pedim to your diet each day. Try a stool softener such as Colace if your stools are very hard. And if you are still constipated, check your symptoms to determine if and when you need to see a doctor.
It's Health Monitor, the number one health show.
Since there are two tubes, if a woman has one of the tubes blocked, then there's a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
Good day to you out there. I hope you're having a splendid week. You're welcome to the assisted reproduction part of the show. I am Dr. Ivy and I'm from True Care Fertility Clinic. So today I'm going to be talking about one of the commonest causes of infertility in our environment, and this is tuber blockage. So what is tuber blockage and what are the fallopian tubes? I want us to understand what the fallopian tubes are and what its function is. So the fallopian tubes are a part of the female reproductive system that is responsible for basically movement of the egg. So once a woman ovulates in the ovary, the egg is released into the fallopian tubes, and then the spermatozoa, when she meets with her partner, spermatozoa comes through the vagina to the womb and swims all the way to the fallopian tube, where the egg and the spermatozoa meet themselves. So when the spermatozoa meets with the egg, it goes into the egg and then fertilization occurs in the fallopian tube. Well, when fertilization has occurred, we call it embryo or a zygote. The zygote now moves back to the womb to attach. So the function of the fallopian tube is basically movement and to nourish that embryo prior to movement back to the womb. So it's very important. It's a very thin tube. It's something like as thin as Indomie, cooked Indomie. A lot of us can understand how thin that can be. So it's really very thin. And so any factor that will cause blockage in the tube will make it to lose its function. When you have the tubes blocked, meaning that the egg and the sperm will not be able to meet. And every woman has 2 fallopian tubes normally. Every woman should have at least 2 fallopian tubes. So you have one in the right, one in the left, and the linking from the uterus, that's the womb itself now, to the ovary. So it's like the arms of the uterus of the womb. So you have the eggs moving through the fallopian tube and the sperm moving to the egg and fertilizing it, then moving back to the uterus. So it's more like a passageway. So what happens if this passage is blocked, and what can block this passage? There are so many things that can be responsible for fallopian tube blockage, but the common ones, you have sexually transmitted infection, gonorrhea, chlamydia, especially in women. most of the male folks, if they have gonorrhea, they usually have difficulty in urinating. So they know that they have gonorrhea and they get it treated. But if they don't inform their partner that they had this, the woman may have asymptomatic disease, meaning that she doesn't have any symptom. She doesn't know she's having gonorrhea, or she may just have pain, a little pain on urination or excess vaginal discharge. But most women may ignore that sensation because it's not as serious as when a man has gonorrhea. So a woman has gonorrhea, it goes up from the vagina, moves to the womb, from the womb moves to the fallopian tube, causes PID, which is a pelvic inflammatory disease, and then you have a whole lot of infection around the pelvic, and then the tubes are involved. After this, the body on its own tries to resolve this infection, and as the body is trying to resolve this infection, you have adhesions. Adhesions is just like a scar. When you cut yourself, you have a scar. But in the tube, inside of the body, it's called adhesion. So you have adhesion forming inside of the fallopian tube. And when you imagine tube as thin as Indomie, if something should, it's easy, it can get blocked very easily. Once it's blocked, then you have infertility in the long run. Any woman with tuber blockage may not be able to, like I said before, the egg and the spermatozoa wouldn't meet. So it's like a fence now, blocking the ability for the egg, of the spermatozoa to fertilize the egg. And this is usually because of this is one of the commonest, this is the commonest cause of female infertility in our environment. So which other factor can cause tuber blockage? You have things like previous surgeries, like mammectomy, you have appendectomy, and you can also have congenital abnormality where they are absent, where you have absence of the fallopian tubes. So in cases like surgery and appendectomy, if someone has a septic appendix, because of the proximity of the appendix to the fallopian tube, you can have infection moving from one organ to the other. So bacteria from the appendix can move to the fallopian tube, and then the healing process, like I said before, because the tubes will get blocked. Then you have conditions like endometriosis as well. Endometriosis simply means the lining of the uterus, that's the lining of the womb. Now, every woman ideally should see her menstruation every month. And then this is a process whereby she sheds off part of the lining of the womb. So if this lining now that you have in the womb goes to the fallopian tube, though you see it commonly in the ovary, but if it goes to the fallopian tube or other structures around, so as she's seeing her period, this lining that is elsewhere is also shedding. And as the body will have it, you have a lot of adhesions forming. Adhesions like scar is a way of healing. And then you have this scar forming everywhere, so you can have the scar forming in the tube, and then it blocks the fallopian tube as well. So these are some common causes of tuber blockage in our environment. So what is the way forward when it comes to tuber blockage? Because a lot of people just think, okay, the doctor told me that the tubes are blocked. What do I do? Should I go for flushing? Should I go for recanalization? Yes, all those are methods of managing tuber blockage. You can tuber flushing, tuber recanalization, but you have very, very low success rate with that. With the outcome of tuber surgery and tuber recanalization, we have low success rate all over the world. And then you have the risk, even tuber surgery can increase the risk of a woman having an ectopic pregnancy, especially a tuber ectopic. So having said this, what is the best solution for a woman who has this kind of challenge? Because now her husband's seminal fluid analysis, the result is okay. She has eggs, but the tubes are blocked. What we do in that case, the best option for a woman like that is in vitro fertilization. Like I will always say, IVF is one of the best things that happened to women and married couples who have challenges. Because in IVF now, what we are going to do, we go straight to the ovary. The ovary is a storehouse for the eggs. A woman's eggs are stored in the ovary because she's born with a fixed number of eggs. And if a woman does not act fast, her egg storage may get depleted over time. So what we do in IVF, we go straight to the ovary, grow her eggs, give her some drugs to grow the eggs. Once the eggs have grown to an extent, we collect these eggs out. Once they have grown to an extent, they are mature. We give them what we call as an injection. We give them to mature the eggs. Then we collect these eggs in the laboratory, bringing out the eggs. We then use her husband's sperm to fertilize this egg. That we take the spermatozoa, use to fertilize the eggs that we have collected. Having done this, we check it after 18 hours for evidence of fertilization. So when fertilization has occurred, we call the developing baby now an embryo. We watch these embryos. At TrueCare Fertility Clinic, we always ensure our embryos get to the 5th day in the laboratory. And that means for you to be able to get to the 5th day, meaning you have a very good laboratory. Because by the 5th day, the chance of implantation is higher. You have a blastocyst embryo by the 5th day. So we take our embryos to the 5th day, which is a blastocyst. Once the blastocysts have grown, we take the baby now, the embryo, and we transfer back to the uterus of the woman. That's the womb of the woman. We put it back into the womb. So you see now that the process of normal reproduction, where you need the spermatozoa to swim through the fallopian tube and meet with the oocytes, is carried out in the laboratory. So now in the laboratory, we take out the oocyte, that's the woman's egg, the eggs, and use the sperm directly to fertilize the oocyte. So we don't need the fallopian tubes when it comes to in vitro fertilization. So it's a very good thing. So every woman out there who has tuber problem, the earlier you come, the better. Rather than looking for a solution that you may not get, some women believe, okay, is there any drug that can treat tuber blockage? No, there is no drug that can treat tuber blockage. Like I said before, the tubes are really, really thin. And when you have anything obstructing them, it's really difficult for you to treat it. Thank you very much.
It's Health Monitor, the #1 health show.
Banana. These sweet delights have more potassium than most fruit and may help lower blood pressure levels. Did you know people with rubber latex allergies may also be allergic to bananas, since the two come from similar trees and share a common protein?
It's Health Monitor, the #1 health show.
Yes, I was talking about acupuncture. Acupuncture has a lot of benefits if it is incorporated into our healthcare delivery system. Why? Majority of people believe acupuncture can only cure pain. It is not only about pain. Acupuncture has some other benefits. For example, acupuncture have the ability to enhance the immune system. What am I talking about? It has been observed that after taking acupuncture, the body's immune system, especially the white blood cells, they replicate, they replicate very, very quickly. And when they replicate like this, a process called leukocytosis takes place. Leukocytosis means leukocyte, the white blood cells in the body, they replicate immediately after taking acupuncture. So this one can enhance our antibody system. Not only that, acupuncture has what we call motor recovery system. What do we call motor recovery? There are some people today who are down with paralysis, and the best Western medicine can do for one who has gone through stroke at the end of the day is to put him on physiotherapy. That's why you see many of them, they will end up with one hand and one leg, maybe their mouth is bent to one side like this. That's the last they can do. But acupuncture can take it further from that to still allow the patient to live a very useful life when it is combined with physiotherapy. So one will be wondering, why are these things not still known? So these are food for thought for our authorities. Then apart from that, acupuncture can also be used to take care of what we call addictive tendencies. People who are on addiction, maybe it's smoking or anything, you can use acupuncture to address that. Acupuncture can do quite a lot of this. Then it's also used for homeostasis. Homeostasis means the ability of the body working parameters to function at equilibrium. Acupuncture can do that. People with high blood pressure, people who are asthmatic, acupuncture can relieve them in some cases instantly. It's incredible, So why are we not encouraging it? You know, so let me now leave acupuncture. Acupuncture can also be used to relieve back pains. You know, it's when you want to give birth, they subject you to anesthesia. Acupuncture can be used. Acupuncture can also use to even correct a malposition photos. What I'm saying is, if there is a breech presentation during the full-time delivery, acupuncture is capable of enabling the baby to present a normal position, come with his head. There will be no room for CS. Maybe that's why some people will not like that, because they will feel that it's going to block their revenue earning characteristics. We don't need that. Patient's interest comes first in anything we want to do. So let me leave acupuncture a bit and go to other areas like osteopathy. Osteo means bone. Pathy means diseases, bone diseases. There is an area in alternative medicine called osteopathy. They believe that liver structure governs function. In other words, when your bones are in their right position, you will not be sick. But if there is a displacement, maybe the way you walk, the way you carry yourself, because of the work you do, you slightly, stretch your back in such a way that there is a displacement in the vertebral column, especially the bone of the back. It could result into so many problems, both systematically and metabolically. You can have a lot of problems. The job of osteopathy is to correct this one without any surgery. That is called osteopathy. It was started in England by Andrew Taylor Still so many years back. Then that is osteopathy. Then apart from osteopathy, we have other areas. We have chiropractic medicine. The chiropractors concentrate more on the spines. Let me tell people watching this program, we have specialists in all this field I'm talking about in this country. So it's not a thing you have to travel abroad. We have chiropractors in this country. We have osteopaths in this country. And we have naturopath. Homeopathy is the next one. Homeopathy believes that they use likes to cure likes. What am I talking about? Homeopathy believes that a particular substance in its crude form, the problem it can cause at that stage, when that substance is diluted infinitesimally, it can cure that disease. What am I talking about? Let's take, for example, our onion at home. When you are cutting your onion, what happens? Water will be coming from your eyes. Homeopath can take this onion, they can turn it into medicine, they will dilute it very highly. You can still use this same dilution to treat watery eyes. That is why they say likes cure likes. It was developed by Heinemann many years back. Heinemann happens to be a Western trained doctor who discovered this. Homeopathy is very acceptable, it's very popular in Germany and some other countries. And in Nigeria, we have so many homeopaths. Go to the eastern part of Nigeria, you see so many homeopaths there. We have to harness all these things. Instead of taking ordinary cough or headache to UK, you can treat them here. That is homeopathy for you. I think more or less I've gone around the whole 5 aspects of medicine to show you that in this country we are blessed. All we need to do is to look inward, and that is what this present government is looking at, local content. This is part of our local content. Complementary and alternative medicine is part of our local content. And I want to plead with the government to make sure that they follow this thing in total, because there are some people who are out there to sabotage the effort of the government because of their selfish reasons. Some people are not feeling secured. Some people are feeling jealous that certain aspects of medicine are being recognized at their own detriment. That is not correct. The healthcare situation in this country depends on all of us. All of us have a stake. Traditional healers, complementary alternative medicine practitioners, Western medicine. We should all cooperate. This is what you see in developed countries. When you are here in America today, that is what happened there. When you go to America, you see chiropractors. They are living very well there. You see acupuncturists. When you go to Britain, you see osteopaths. And this is where our elites are going to when they are sick. They are not going there to take injections. We have injections in this country. They are going there for all these therapies. Even our sportsmen. I remember a particular sport meet when the other countries brought all these practitioners. Most of our athletes were leaving our camp. They were going to take all these practitioners. They were taking cupping. They were taking acupuncture from other countries. You see? And we have them in this country. But because of our hypocrisy, we don't recognize all these people. So I want to really plead with the government to shed its light on this aspect of medicine, so that this kind of this category of practitioners could be recognized, and because they have a lot of role to play in our healthcare delivery system. Let's talk about dosage. A lot of people are saying, traditional medicine doesn't have dosage. There can be abuse. Those are old school thought. During the days when the late DJ of NAFDAC came on board, that is the late Professor Dura Akunyili, all these things have been put in place. When you see some herbal medicine, now you will not even believe they are herbal medicine. They have been well packaged, and many of them have been NAFDAC approved. If they don't have dosage, NAFDAC will not approve them. So don't shy away from taking our own medicine. But when you can talk about maybe at the village level where people take what we call agumu, whether you like it or not, people who are taking agumu, some of them are living 150 years. Those of us who don't take agumu, hardly can we even spend 50 years. What is the life expectancy rate in Nigeria? 54 or 57 now. So what are we talking about? So we should go back to this old medicine that is giving us longevity. Let's put some science into it, and we shall move to the next level. Then talk about the price. As far as I'm concerned, complementary medicine is relatively cheap, because in a situation whereby you have been battling with an ailment for so many years, you've been to so many hospitals, and then you come to a complementary medicine healer, and with just 3, 4, 5 sessions, your problem is abated. Which one is cheaper? That's why they say penny wise, pounds foolish, So because of that, so the issue of being too expensive is not there. We need to develop it. When we develop it and we have so many people who are into production, the prices will become bearable. Look at our herbal medicine today. Go to pharmacy. You will see some medicine of some practitioners. I don't want to mention their names. You see it on pharmacy. That is an improvement. Unlike before, you dare not sell herbal medicine in chemist or pharmacy, but it's not like that these days. In fact, if you go to some pharmacy, a particular department will be dedicated for natural herbs, both our own and locally made herbs and foreign herbs. But what we are saying is that we should not allow foreigners to turn Nigeria to dumping ground. Let us encourage our own people to. Let's give them this initiative to be able to produce so that we can also export. We see Ghanaian medicine here. When I visited Ghana, I didn't see any Nigerian medicine there. But we have a lot of their medicine at Agege. But I was in Accra for 1 week. I didn't see any Nigerian drug there. You see? So what we see there are Nigerian dresses, Nigerian shoes. What about Nigerian dresses? Nigerian medicine is not there. So we need to look into it. The way you call your medicine is how other people will carry it. If you don't carry our medicine with respect, people will not respect us. So we need to take our medicine to the next level. People in abroad, when they come home, they always run around for our own medicine because they've seen the efficacy, So, it's very, very simple. You are eating amala, eba and ewedu. Somebody brought you Chinese medicine and you are using it. How will it work? But if you take our own agbo, our own dongoyaro, our own awokpa, you take our own food, it will work together because it is grown on the same soil, the same environment. That's how it's going to work. But those medicine abroad, they will put preservatives there. Some of them, they spend 6 months on the sea before they come here. And then people are now saying, is this the one we should be taking? Are we not fooling ourselves? Certain we wake up. So we should take our destiny in our own hands. We should take our medicine with both hands, with prestige. We should carry it with prestige. By so doing, we shall move to the next level. And that's one of the philosophy of this present government. So the question anybody can ask is that, is it safe to patronize complementary alternative medicine? The answer is yes, it is safe. But, don't patronize any practitioner who you always see on TV, on radio, making all sorts of claims. That is not the issue. The issue is patronize those that are qualified and certified by the government of the Federal Republic of Nigeria. For example, in Lagos State, if you are practicing herbal medicine, you have to go to Lagos State Traditional Medicine Board, who will verify, who will train you, who will regulate, who are regulating the practice. If you are a Western trained doctor, Medical and Dental Council is going to certify you. If you are practicing complementary medicine and alternative medicine, Medical and Dental Council will certify you. Me that I'm talking to you, I'm certified by Medical and Dental Council of Nigeria. And for 2 terms, I was a member of the council regulating the practice in the country. So before you patronize anybody, don't patronize anybody on sentiment or because you know the person. If you know him, I always ask my patient, when you go to people like that, ask for their credentials, ask for their license. Do they have license? If they don't have, please don't patronize them because your life could be at risk. And some of them may not be well trained. And that is what government is trying to do. Government is telling them, bring your CV, let us verify it. None of them couldn't do that. So what we are saying is patronize those that are qualified. Don't patronize somebody because he has built a very big signpost. Signpost does not heal. It is what you have here that can heal you. And the only way people who can regulate that is the government, Ministry of Health, people that are certified by Medical and Dental Council. Those are the people that could be contacted. People that have proven integrity. Integrity is about practice. So those are some of the things we have to look at. Thank you.
The number one health show.
How to deal with constipation. Constipation can be treated at home. First, try gentle exercise. Take a short walk each day. Make sure you drink enough fluid. Most adults should try to drink between 8 and 10 glasses of water or non-caffeinated beverage each day. Include fruits, vegetable and fibers in your diet. Schedule time each day for a bowel movement. If you are still constipated, add some processed or synthetic fiber such as Citrusel or Pedim to your diet each day. Try a stool softener such as Colace if your stools are very hard. And if you are still constipated, check your symptoms to determine if and when you need to see a doctor.
The number one health show.
Now we have come to the end of the program. I hope you have learned one or two things. Till I come your way next time, I am Adenike Famujuro Fakayode. Stay healthy and be healthy.